So I'm going to be talking about one of our ongoing projects, Drink Less, Enjoy More. And it's a model to address problematic drinking in the nighttime economy. We've been doing it for quite a few years now, so it's an ongoing project. So firstly, just some background. So it's been illegal to sell alcohol to people who are drunk for 400 years. And the idea behind this was to prevent violence, antisocial behaviour, and to protect vulnerable people. The Licensing Act in 2003 states that it's illegal to knowingly sell alcohol to someone who's drunk. However, there's very few prosecutions of this. As you can see, over a 6-year period, there was only 32 prosecutions for selling alcohol to drunks, which is quite surprising considering the high levels of drunkenness in the nighttime economy. Across the country in all different nighttime economies from all different cities. This suggests that the law isn't either being implemented or enforced. Some studies have suggested different reasons for this. Firstly, it's difficult to identify drunkenness within nightlife venues, and also then once it's been identified, how to prosecute it. So across nationally and local levels, a broad range of interventions have been implemented to reduce the harms associated with drunkenness in nightlife settings. Whilst there's some evidence to show that they reduce and limit alcohol-related harms, they do little to address the culture behind drunkenness in our nighttime economies. In a study conducted in Liverpool in 2013, 84% of alcohol test purchase attempts in bars and clubs by pseudo-intoxicated actors were successful. And there was even some evidence of upselling, so some bars offered the actors doubles. Some actors were offered doubles or special drink promotions, even though they were obviously very intoxicated. So that led to the intervention. It was originally piloted as Say No to Drunks, but then was later rebranded to Drink Less, Enjoy More. It's an ongoing project that's been piloted, evaluated and monitored by the Public Health Institute and alongside local partners, so Liverpool City Council and Merseyside Police. It's run on an ongoing basis with intensified efforts during periods associated with high levels of alcohol harm, so around the Christmas period, Freshers Week, sports events, that sort of thing. There are 3 main components to the intervention. So firstly, community mobilisation. So this involves getting together a multi-agency steering group, so local authorities, Public Health Institute, the police, and it involves partners' engagement with community and licensed premises. And they run awareness-raising activities through the press, social media, and other media outlets. Next is bar staff training. So a free 30-minute face-to-face training programme is run with members of staff from bars, and they sort of focus on preventing the sale of alcohol to drunks, raising awareness of laws, service refusals and conflict management techniques. And then lastly is engagement. So police and licensing will visit bars or send letters out to bars to raise awareness around selling alcohol to drunks. So all those 3 work together to make up a multi-component intervention. In Liverpool, we've implemented a range of methods to inform the development of the intervention and measure its impact. The 2 main methods that we use are the nightlife user surveys and the alcohol test purchases. Both of these are implemented and evaluated on a yearly basis. So for the nightlife user surveys, these are short, anonymous surveys that are done opportunistically with people from Liverpool's nighttime economy, so nightlife patrons. And they're usually done typically on a Friday and Saturday night. And these surveys explore awareness of alcohol legislation, perceptions and attitudes relating to drunkenness, their levels of alcohol consumption, and what their perceptions are of the intervention. We also do pseudo-intoxicated actors test purchases. And these just measure staff's propensity to sell alcohol to drunk customers. The actors are recruited from Liverpool John Moore Screen School, and the acts are verified for consistency by members of the police. So, and they're usually conducted across 5 nights, Wednesday through Sunday, typically 8 p.m. to 4 a.m. And they're done in 100 randomly selected bars through Liverpool. And then finally, we did bar staff surveys. We only did this for 1 year in 2015. And we did a total of 51 surveys. And these were conducted with actual staff working in bars at the time. And they just assessed the bar staff's knowledge of the law and their awareness of the intervention. These are just some of the findings from the bar staff survey. And you can see that they're all very positive. The majority of staff knew that it was illegal to serve alcohol to a drunk person. 96% knew that felt confident in refusing service. 94% felt confident in managing drunk customers within the bar. Most of the staff knew that it was illegal to sell alcohol to a drunk person or for somebody to buy alcohol on behalf of a drunk person. However, it's not that simple, and if that was the case, then we wouldn't have drunkenness in the nighttime economy. So our alcohol test purchases show that 84% of those bars serve the actor, even though they were displaying high levels of intoxication. Once it was rebranded from Say No to Drunks to Drink Less, Enjoy More, there was a significant drop in the levels of service to the actors, and this has stayed consistently low over the years. This suggests that it's not only sustainable but also is applicable to other areas as well, which I'll go into in a minute. Interestingly as well, we also ran the intervention at a different time of year. So this year we ran it in February, just to see if usually when it's not being ran or the campaign's not at its full strength, if it still remains low, which it did. So that was a good sign that that message is still sort of implemented into the works bar staff's training. And then finally, I focused on 2 of the key findings from the Nightlife user survey. So firstly, knowledge of the law, and then also intervention awareness. So there was an increase across the years for nightlife patrons knowing that it was illegal for bar staff to sell alcohol to customers who are drunk, and also that buying alcohol for a friend who's already drunk is also illegal. And you can see that awareness has increased over the years, sort of tapered out a little bit in 2017, but still an increase from the initial pre in 2014. And then awareness of the intervention itself was 17.2% of the participants that we surveyed knew about the intervention, and this has increased throughout the years, or it's remained at an increase from the pre anyway, and that's been sustained over several time points also. So as I said, it's been implemented in Liverpool since 2014 onwards every year, but it's also been implemented across other places. So we also ran it in Manchester, South Wales, so in Cardiff. The interventions were slightly changed to different areas. For example, Manchester only implemented the bar staff training and in the enforcement, but no community mobilisation was used. They did see a reduction, however, it wasn't as impactful as Liverpool, and it just suggests that all components of the intervention are needed in order for it to have the biggest impact. And then again, we also did it in Cheshire and Merseyside, so it was implemented across 8 local authorities. Nightlife surveys were done in all of those 8, so Sefton, Wirral, Warrington, Halton, Cheshire West, Cheshire East, Sefton, St Helens and Knowsley. And the actors test purchases were done in Sefton and Wirral. And then also as part of a bigger, larger European project called Stars in Europe, Wrexham was chosen as the UK pilot site to address home drinking and preloading. So we implemented a similar intervention where the idea is that if you get drunk at home or if you preload a lot at home, then you're not going to get served and you're not going to get into bars once you're in town. And a lot of the intervention materials focused on, that you're going to ruin your friend's night as well as your own, that you'll end your night early and have to go home early. And so those are the deterrents that were kind of used, rather than that, you can't drink in the nightlife economy. You just... so other countries that were involved in that project were Sweden, Spain, Slovenia, Germany, Netherlands and Czech Republic. I won't go into too much detail about the findings, but for each of the areas, knowledge of the law, awareness of the intervention and the sale of alcohol to drunk customers were all significant. So the awareness of the law and the intervention, the awareness increased and so did knowledge of the law, and the sale of alcohol to drunks decreased. This suggests that the intervention can be successfully applied to a range of different nightlife settings, from cities to small towns, and also from different countries as well. And that's it. Thank you.